Guys, welcome back to Medical Coding with Blue. Today's episode is all about, are medical coders leaving for the tech industry? If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so I got this comment. I'm going to read the comment and then we're going to get into it. So here we go. So the viewer says, hello, Blue. Lately, I have noticed that medical coders are starting to transition into the tech industry because they are reaching a salary plateau in medical coding. The concern is also that medical coders have to know a lot of information but are not being paid their worth. Would you mind covering the salary trajectory for medical coders in the near future, please? Thank you for everything that you do for everyone in the medical coding community. I am looking forward to learning more from you in 2024. Here's the thing, guys. I never talk about money in specifics on my channel. Never, ever, never, never. And I'm not going to start now. The reason that I don't, and don't get upset at this, because a lot of people get really upset at me because I don't talk about money in specifics. But here's the reason why. And you have to listen to this, okay, in order to be able to really get what I'm trying to say. A lot of people sell the industry of medical coding based on the money. I am not one of those because I truly do love medical coding and I love the industry of health information. I really do. So when I see people try to get into it for the money, it's very irritating because those people are not trying, most of the time, they're not trying to learn about the body and the disease process and all these things that we have to know as medical coders. They are fixated on the money and they think that they deserve this money. Well, if your knowledge is not marrying up with the money that you want, you don't deserve that money. That's number one. Number two, here's the other thing. When you're chasing money, you're never going to be truly satisfied. Never. So here's the thing. If you are getting into an industry that you know pays well, everybody talks about how well medical coders get paid, and we do. If you are not getting paid well and you think that you deserve more money, then apply at another place. Don't just stay there. But the thing is that people expect to start, and they expect to start at a really high salary and not have worked up to it because, again, these schools and the people that are selling these programs are the ones that are pushing out this information. That's why you will never see me talk about money in specifics on my channel. Never, okay? So that's the thing that you have to know there. But here's the thing, guys. People in the tech industry have to know a lot too. And they have to know math. Whereas we have some math, if you're doing the coding, the math is more in line with the billers and the revenue cycle folks. But again, this is very simple, straightforward formula math. This is not complicated math. Techs have to know complicated math. And so that's the difference between us and them. But if you want to get into medical coding and you decide that, you know, you've been in it for maybe a year or so and you're just not getting paid your worth and you're going to go into the tech industry because they're paying a lot more, then that by all means go ahead because the industry doesn't need you. The industry needs people that are going to be passionate about what they do. Because when you're passionate about what you do, oh, trust me, the money will be there. And it will be there in ways that you don't even expect. So that's the thing that you have to know right off the bat. So let's just get that out of the way. Now, the other thing is this, guys. What we do, yes, it requires us to know a lot. But because of what we do, that is why. We have to know what doctors know while never having gone to medical school. So with that, yes, we do have to understand a lot. And no, we don't get paid low. If you're getting paid low, then you need to go find someplace else to work. Because yes, there are people that don't understand what we do and they will try to pay low. So it's up to you to be able to go out and find your place that you know that is going to pay you your worth. But if you're insisting on, well, I only plateaued at this much and I can't make no more. That's a mindset that you have. That's not a reality. That's something that you're thinking. And I really don't like blanket statements like this where I've seen so many coders leaving for the tech industry. I know a lot of coders and I don't see them leaving for the tech industry. So when you make blanket statements like that, somebody else will see that and then they'll be saying, oh yeah, medical coders are leaving for the tech industry. And when it's not even true. Okay, some may leave for the tech industry, but those are people that are bouncing from career to career again, and they are trying to chase the money. So again, that's when that doesn't work. But this is a very good field that is going to continue to grow. When I started my first job, I started off at a very good salary when I first started, right? I got a very good pay and everything like that. Well, my next job, I got a considerable jump on that next job. And it wasn't just a little bit here and there. It was considerable. And I was like, wow, this is really awesome. Then when I got to my forever home, I had another considerable jump. And so I was just like, wow, I was blown away. But I wasn't doing it because I was chasing the money. I knew medical coders got paid well, but I didn't know that they got paid that well, especially for somebody like me who had not even a year of experience yet. And I had already had the jumps in pay that I had. So that's something that you have to really think about when you're out here making blanket statements about, oh, well, you're not getting paid enough, or you're not getting paid your worth. Again, if you're not getting paid your worth, then you need to start applying again. That's when you need to make sure that you have all of your skills on your resume that is going to tell the employer, hey, this is what I have done this whole time I was at this organization, and this is the skills that I'm bringing. Oh, I was working in a cardiology clinic, so I'm very familiar with, cardio. I'm very familiar with the procedures. I'm very familiar with the disease process. I worked with the encoder 3M, let's just say, for example. And so those are the things that when you're seeing those things, okay, the employer's like, all right, this person has experience working with Epic or eClinicalWorks or Cerner or any of those. Okay, great. They know how to work in the electronic medical record. So, we happen to be paying this. If you are making a certain amount of money and then you say, okay, well, this next job, I'm going to ask for a 10% or 20% raise, then you can go in there and they'll ask you, what are you looking for? Or you can do your research and find out how much they're paying their people. And if they offer you the job and you're making the same as the other place and you say, okay, well, it's not worth it for me to go, well, then don't go, right? But if they say, okay, well, yeah, that's reasonable, we'll give you a 10% raise or 20% or whatever you're asking for. Okay, great. We'll go ahead and do that. And then there, you moved up in pay. So when you move up in pay, okay, now you really have to step up your game. And if you're there and then you say, okay, well, I'm learning this, I'm getting more skill, and I'm not just working in cardio, maybe I'm working in the ER as well. Okay, great, because when you work in the ER, that really does expand your knowledge base, all right? And when you start focusing on learning all of these things, guess what? That next opportunity may present itself and you'd be like, okay, well, I have been here for a year, or I've been here for 2 years. Now let me see what else I can apply for. So I'm going to put out my feelers and I'm going to see what can I apply for? Okay, I'm going to ask for a 10% raise or a 20% raise from what I was making. Okay, and if they say, okay, yeah, that's reasonable. Okay, now you go on to the next job. That's how that works. But if you're sitting there thinking that, well, if I do all of these great things at this job and I'm just waiting for a raise because I think that they're going to reward me, they're not. You have to ask for it. You have to show that you've been doing right and that you've been doing all of these things. And if they're not willing to give you that raise after a year or after 2 years that you've been there, and you say, okay, well, I think it's time for me to move on to another job, then you start looking. Don't you start announcing your plans, though. That's the thing. People need to stop talking and they need to start doing things and then make your move and then do what you got to do in order to move on to the next job. But don't be saying, well, I'm going to start looking for another job, because then there's a lot of office politics that happens, guys. We all hate to talk about it, but it is the truth. A lot of people do get upset when people try to leave and that kind of thing, or they try to do things to stop them from leaving. But it's at will. It's an at will work, you know what I'm saying? Unless you've signed some kind of contract, which is weird, But, for the most part, it is an at will work environment, okay? So don't just wait around for people to reward you because you think that that's going to be the right thing to do. Yes, it is the right thing to do, and yes, they should. And good companies will. However, that's not all companies. And there's going to be some companies that they're going to try to get as much work out of you as possible. And we all know that happens. That's why I tell y'all, if you're trying to get in, don't get into these medical receptionist positions that they say, oh yeah, well, they're going to promise me that I can do some coding, because now they got a coder out of you and they get a receptionist out of you. They're working you excessively because they know that you want to be a coder. And then when it comes time for you to get a raise or try to leave, they're going to try to stop you because you've been doing such a fantastic job doing all of these things. Why would they let you go? Because the next person that comes along is probably not going to know about coding, and you did. So that's why I'm telling you guys, you have to be smart. And you have to know when to say, okay, you know what, I've done this, I've done that. It's time for me to move on. It's time for me to find another job, or I'm going to get my resume fixed up so that way I can go and look for another job. There was somebody on Instagram, a lady that I follow, I can't think of her name, horrible with names, Vivian. This lady named Vivian was talking about how that there was an article that she had read, and that they were saying that people who move jobs every 2 years are the ones that get paid, because they are the ones that can ask for 10% or the 20% raise. And it's just here, it's just there. Had they stayed with that first organization, they wouldn't be making what they're making now after they've been moving every 2 years. And so if you're moving every 2 years, you're getting those jumps in pay that you've been looking for. Okay. So you're not just plateaued that you can't make no more. Trust me, if you've been getting your sufficient pay increases, and you've been learning and you've been amassing all of this knowledge, you will get paid your worth. People that don't get paid their worth are the people that are going to sit here and wait to be spoon-fed their raises, because they think that that's correct, the correct way to be, and that's what they deserve. No, guys, if you are not getting the proper pay like you think, and you're being reasonable, not something that's not reasonable, guys. Please don't be like that, okay? Especially if you don't have experience in the industry, be reasonable. Go to the Department of Labor or the Bureau of Statistics, and it will tell you how much medical coders make in your area. Do not ask me, guys. Do not ask me. I will not tell you where exactly the page is, because some knucklehead always tells me, what is the link? No, I'm not giving you the link. I just told you, go to Google. Type in the Department of Labor or the Bureau of Statistics, and when you get to that website, it will tell you how much medical coders make in your area. So that way you're doing your own research, because doing your own research is what is important. Because again, when you listen to people like this that made this comment, that are making these blanket statements, oh, everybody's leaving for the tech industry, and that's not even correct. But again, you're putting false information out there, and some knucklehead that's not doing their research is going to go right along with it. Think about that, guys. And when you think about where you are and the skills that you have and everything that you're bringing, if you say to yourself, you know what, in this new year, I'm gonna take the bull by the horns, and I'm gonna do the most scary thing ever. And I'm going to go out there and I'm going to try to find a better job that's going to be more suitable for me, maybe in a less toxic environment. If you're one of those toxic environments, and you're going to say, okay, you know what, I'm going to get out there and I'm going to get what I deserve, because that's what I'm supposed to do. A lot of people are not going to want to be the new person. Nobody wants to be the new person, especially after you've been with an organization for a considerable amount of time. But sometimes that's what it takes. And especially in the economy like we have today, where what we make is very critical to like being able to keep a roof over our head and put food on the table. That's something that you need to think about. But obsessing over the money is what's going to get you every single time, because if you do that, you will never be satisfied. Okay. But if you focus on learning and then amassing that knowledge, well, guess what? Now you have more to leverage. Now you say, okay, well, I've done provider education. I've done, CDIs type tasks where I looked and I was helping them to improve their documentation to be more clearer with what was happening in their visit. That's something that you can put onto your resume. If you were assisting other medical coders and you were training them, that's another thing you can put onto your resume. If you were working in different specialties, maybe you were helping out in the ER and you're an orthopedic coder. Okay, great. Now, okay, you can have that on your resume, so that way you can show all of your skills, because they don't know you. They don't know what skills that you're bringing. They only know that you're applying for their job. And the fact that, you're going there, you need to make sure that you know about that facility too, especially when you are going in for that interview. If the facility that you want to work for, is named after somebody, and you don't know who that person is, and they ask you during the interview, do you think you're going to get the call back? No, because you weren't even detailed enough to know where you're applying. You're just out here willy-nilly, put out applications and just hoping somebody picks you up. That's not the person that's going to get hired. That's not the person that's going to get that raise either. I'm just saying. So anytime that you decide to move on from your job, make sure that you are applying. Make sure that you have a job secure before you leave your job. We'll say that again because a lot of people don't hear some of the things that I say. Make sure that you have a job secured before you leave your job. Do not leave yourself without a job. Make sure that you are quiet about the things that you are preparing yourself for. Do not go and tell your buddies, your friends, your coworkers, even if you say, oh no, Blue, we hang out after work and we do all these things and we're best friends. Oh no, trust me, guys. No, not in the work environment. No one is your best friend in the work environment. No one. You can't. You cannot trust these people to have a little bit of information because it takes one thing for them to get upset at you, and then everything that you ever said is going to be all over the place in that facility. Okay? And again, we are a small industry, even though there are thousands of medical coders. It is very easy to get a reputation for anything. Okay? So that's why you want to make sure that you keep things to yourself. Don't be announcing stuff on social media. Don't be doing that. You know, make sure that you are keeping it to yourself, and make sure that you are being careful about like when you're applying and things like that, because you don't necessarily have to have them call your employer, because they will always say, you know, you can decline them to call your current employer, you know, so that way they don't have to know that you're out there applying. Because just keep in mind, when you put in your notice, there are some people that are petty and they will make you miserable for the next 2 weeks that you're there. Rather than just being mature about it. And that's unfortunate because there are some managers that are like that, you know, but you want to make sure that you're just prepared. You prepare yourself and know that you're going on to a better place. And there's going to be people that are not as brave as you to say, okay, well, I'm not making what I should be making here. I need to go someplace else that's going to pay me a little bit more so that way I can get the things that I need. That's what you're supposed to do. Okay. But again, let's talk about getting those skills, putting it on your resume correctly, and getting your resume down to 1 page, no more than 2 pages. Don't go back no more than 10 years, so that way they can see the most relevant experience. And for those of you who say, well, no, that's lying. It's the last 10 years. Do you think that they expect you to remember your skills and everything that you did from the 90s or the early 2000s? Do you think that? Because if they really need that information, they'll ask you for it. But you can go in there with the last 10 years on your resume, and that's totally fine. 10 to 15 years is totally fine. But again, if you're saying that it goes back all these years, again, you're showing your age on your resume, which you shouldn't be discriminated against for your age. But again, let's not have them throw you out beforehand. We want to be able to have the opportunity to get in front of them. So let's just say, okay, we have that, maybe we've been working for 10 years. Okay, here we go. And that's the 10 years back that we can go. Because again, that resume is just a snapshot of who you are. When you get in there and they ask, okay, we need your complete work history, then you can give it to them. But until then, no. You just introduce yourself. That's all you're doing with that first resume, is introducing yourself and your skills and everything else that you're coming along with. Okay, so that's just something that you got to know. With that said, I know it's scary to want to move on to another job. It's scary to want to have to be the new person again, and no one wants to be the new person. But as you grow your knowledge in this industry, you will be more confident with your skills, and you will be able to make those leaps. As long as you say to yourself, you know what, this is just part of working. This is just part of, you know, being a medical coder, and I'm going to go here, I'm going to go there. But again, when you're out here making statements like, oh, they're plateauing, because you're waiting around for the employer to say, oh, yes, you're doing really good. They're going to try to keep their budgets as low as possible when it comes to their employees and how much they're paying them. If they do, you know, have some kind of generosity and they'll give you your raises and that kind of thing, then that's something different. But a lot of them won't, all right? Because they're going to try to get this labor out as cheap as possible, okay? But you can go other places and look. And I've seen a lot of them on LinkedIn. Some of them post what their starting salary is, and you know, what they expect the person to do. And I'm thinking, no, can you ask people to work for that? No, thank you. And I just move on, you know. So at least it's just my advice anyway. But with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see you all next time. Bye.